post-mortem examination conducted by the Ministry of Health on Tuesday revealed that the 13-year-old lad died as a result of hemorrhaging in the brain caused by a ruptured brain aneurysm. But according to the Minister of Health, Dr. Frank Anthony, the aneurysm was a pre-existing condition.
The patient from Kamwata had a pre-existing condition. So he had a cerebral aneurysm, meaning that one of the arteries in the brain, the walls were slightly weakened and probably causing a bulge. So he was born with that problem, and unfortunately it was not detected before.
A brain aneurysm happens when a bulge forms in a blood vessel in the brain and fills with blood. Aneurysms often produce no symptoms unless they burst open or leak blood. According to the minister, this was not caused by the Pfizer vaccine.
Whether the vaccine caused that or not, no. There's no evidence that the vaccine would have triggered the rupturing of the aneurysm.
Details surrounding the death of the child suggest that he received his second dose of the vaccine at 2 p.m. on Monday afternoon, after which he was observed for an uneventful 20 minutes and then sent home. 2 hours after returning home, the child complained of feeling faint, and shortly after he collapsed. He was rushed to the hospital where he was pronounced dead on arrival. The boy's mother, in a recent interview with Nightly News, expressly said that she believes her son died as a result of the vaccine he was administered. But according to the minister, it was coincidental that the child's aneurysm ruptured and led to his death right after he took the vaccine. He opined that an aneurysm is like a ticking time bomb that can result in death if not detected early. The minister even revealed that there were at least 2 children who had this condition in the past year.
And so you have aneurysm that you will detect in children. And in fact, over the last year or so, we would have had at least 2 cases of cerebral aneurysm in children that we were able to diagnose early. And those children were operated upon, and the problem was resolved. Unfortunately, this was not diagnosed, and therefore nobody knew that this child had such a problem.
Though the 13-year-old's death continues to be the product of public skepticism, it is not the first time a child's sudden death was linked to a pre-existing brain condition. In 2019, a 10-year-old student of the Regma Primary School in Linden collapsed suddenly and died. It was later revealed that the student, June Alexander, died as a result of a pre-existing brain condition called arteriovenous malformations. In these malformations, arteries and veins are unusually tangled and form direct connections bypassing normal tissues. This usually happens during development before birth or shortly after, and can be fatal when left untreated. For the HGP Nightly News, Kendell Richmond.